Hey everyone, welcome back to Brazilians Co. On today's episode, we're going to be talking about the basic of POTS, what does POTS mean, and all that fun stuff. This episode is called POTS 101 More Than Just Dizziness. It's kind of like my spoon theory one, so I'll be reading off a paper because there's so much to cover. So I hope you guys enjoy. Just a little warning, I won't be really looking at the camera as this is like the same thing as a spoon theory. I'm reading off a piece of paper because it's a lot of facts that are important about this topic. So just a little warning that I won't be really looking at the camera. What does POTS actually mean? What happens inside the body when someone with POTS stands up? What can something as ordinary as showering, cooking, or waiting in line feel so physically demanding? A lot of people have heard the word POTS, don't fully understand the condition. Some assume it means feeling a little dizzy when you stand too quickly, but POTS can affect far more than a person's heart rate. It can affect energy, concentration, digestion, temperature regulation, sleep, exercise, and the ability to complete everyday activities. This episode is meant to provide general education and awareness. It isn't medical advice, and anyone experiencing unexplained fainting, chest pain, a heart racing, or other concerning symptoms should speak with a qualified healthcare professional. So let's get into it. POTS stands for Postural Orthostatic Tachycardia Syndrome. That's a long and complicated name, so let's break it down. Postural relates to the position of your body. Orthostatic refers to being upright or standing. Tachycardia means a faster than normal heart rate, and syndrome means a group of symptoms that commonly occur together. Put simply, POTS is a condition involving an abnormal response in being upright. One of its defining features is a significant increase in heart rate when a person moves from lying down to standing. But POTS isn't only about the heart. It is considered a form of dysautonomia, which means the autonomic nervous system isn't regulating certain automatic body functions properly. The autonomic nervous system controls many of the things your body does without you consciously thinking about them. That includes your heart rate, blood pressure, breathing, sweating, digestion, body temperature, and the tightening and relaxing of your blood vessels. You don't normally have to remind your heart to beat or tell your blood vessels what to do when you stand. Your autonomic nervous system is supposed to handle those adjustments automatically. With POTS, some of those automatic adjustments don't work as effectively as they should, though. To understand POTS, it helps to first understand what normally happens when someone stands up. When you're lying down, your blood is distributed more evenly through your body. When you stand, gravity pulls some of the blood downward, especially towards your legs and abdomen. A healthy autonomic nervous system, though, responds immediately. The blood vessels in the lower body tighten, the heart rate adjusts slightly, and the body keeps enough blood moving back towards the heart and brain. Most people never notice this process because it happens automatically and very quickly. In someone with POTS, the body may struggle to make those adjustments. The blood vessels may not tighten effectively enough, the person may have a lower amount of circulating blood volume, or blood may pool in their legs and abdomen. There are different mechanisms involved, and they aren't identical for everyone with POTS. Most people never notice this process because it happens automatically and very quickly. In someone with POTS, the body may struggle to make those adjustments. The blood vessels may not tighten effectively enough, the person may have a lower amount of circulating blood volume, or blood may pool in the legs and abdomen. There are different mechanisms involved, and they aren't identical for everyone with POTS. When less blood returns to the heart may try to compensate by beating much faster. Imagine a water pump trying to move water through a system without receiving enough water back. The pump may work faster and harder to keep everything moving. That is one way to understand what the heart is trying to do in POTS. The faster heart rate is often a response to a larger circulation problem. It isn't necessarily the entire problem by itself, though. This is why standing still can feel like physical work to someone with POTS. The person may appear to be doing nothing, but internally their body is working much harder to remain upright. So how is POTS diagnosed? For adolescents between 12 and 19, the required increase is generally at least 40 beats per minute. This increase happens without the significant blood pressure drop that defines orthostatic hypotension. The symptoms may also be worse while upright, improve after returning to the lying down position, and usually be present for at least 3 months. Doctors must rule out other possible reasons for the increased heart rate, such as dehydration, blood loss, anemia, thyroid problems, certain medications, and other medical conditions. The last part is very important. A fast heart rate alone doesn't automatically mean someone has POTS. Proper testing and medical evaluation are needed because several other conditions can cause similar symptoms. A doctor may perform an active standing test where the person's heart rate and blood pressure are measured while lying down and then at different times after standing. Some patients also have a tilt table test, aka me. During this test, the person is secured to a special table that moves from a lying position into a more upright position, while their heart rate, blood pressure, and symptoms are monitored. Other tests may be ordered depending on the person's symptoms and medical history. Now let's talk about symptoms, because POTS is much more than a number on a heart rate monitor. One of the most recognizable symptoms is heart palpitations. A person may feel their heart racing, pounding, fluttering, or beating unusually hard when they stand. Dizziness and lightheadedness are also common. Some people faint, but not everyone with POTS does. A person can have severe POTS without ever completely losing consciousness. Many people experience presyncope, which means feeling like they're about to faint. Their vision may become blurry, dark, or filled with spots. Their hearing may sound distant, their body may feel weak, and they may need to sit or lie down quickly. POTS can also cause extreme fatigue. This isn't always the kind of tiredness that disappears after one good night of sleep. It can feel like the body's energy has been completely drained. Everyday activities may require much more effort because the body is constantly trying to regulate circulation. Brain fog is another common symptom. Brain fog can make it difficult to focus, remember words, follow conversations, process information, or complete tasks. Someone may know what they want to say, but struggle to get the words out. They may forget what they were doing halfway through doing it too. This doesn't mean the person isn't intelligent or isn't paying attention. Their symptoms may be affecting how clearly and quickly their brain can function in that moment. Other possible symptoms include trembling, weakness, headaches, migraines, nausea, bloating, chest discomfort, shortness of breath, sweating, sleep problems, exercise intolerance, and difficulty regulating body temperatures. Some people may also notice their feet and legs become red or purple while standing because of blood pooling. Not every person will experience every symptom, though. POTS can look very different from one person to another, and symptoms can change over time. Someone may manage fairly well one day and then have a major flare the next. The unpredictability can be one of the hardest parts for people living with the condition. There are also many things that can trigger or worsen POTS symptoms. Heat is a major trigger because it causes blood vessels to widen. When the vessels widen, it can become even harder for the body to move blood back towards the heart and brain. This is why hot weather, hot tubs, and hot showers can be especially difficult. A shower combines several triggers at once: heat, standing, lifting the arms to wash hair, and possibly bending down and standing back up. For someone without POTS, showering might be a simple part of the day, but for someone with POTS, it can also feel like an entire workout. Standing still for a long time can be harder than gently moving. When the leg muscles aren't moving, they aren't helping pump blood upward as effectively. That can make waiting in line, standing at a concert, washing dishes, or talking to someone while standing especially challenging. Other possible triggers include dehydration, lack of sleep, stress, physical overexertion, and eating large meals. After a large meal, more blood is directed towards the digestive system. That shift can worsen symptoms for some people. Alcohol can also make symptoms worse because it may contribute to dehydration and widen the blood vessels. Again, triggers vary. Something that causes a major flare for one person may have a smaller effect on someone else. What causes POTS? The answer isn't always simple. POTS isn't one single disease with one single cause. It is a syndrome, and different people may develop it through different pathways. Symptoms can begin after viral illness, surgery, pregnancy, physical trauma, or another major stress on the body. POTS has also been reported after COVID-19 infections too. It may occur alongside other conditions, including hypermobile Ehlers-Danlos syndrome, autoimmune conditions, migraine, and disorders involving mast cells. Some people have neuropathic POTS, where small nerves involved in controlling blood vessels tightening may not work properly. Others have features sometimes called hyperadrenergic POTS, involving higher levels of stress-related hormones such as norepinephrine. While standing, this may cause symptoms such as shaking, sweating, anxiety-like physical sensations, and a strong increase in heart rate. Some people may have a low blood volume, and many people have overlapping features rather than fitting perfectly into one category. In some cases, doctors cannot identify one clear cause. Research into POTS is still developing, and the medical professionals are continuing to learn. One harmful misconception is that POTS is simply anxiety. POTS can sometimes produce sensations that resemble anxiety, including a racing heart, shaking, sweating, chest discomfort, and shortness of breath. But those physical symptoms can be created by the body's abnormal responses to standing. A person can also have both anxiety and POTS. Having one doesn't cancel out the other, however, POTS shouldn't be dismissed as anxiety without an appropriate medical evaluation. Another misconception is that someone with POTS is lazy or out of shape. Reduced activity can sometimes worsen symptoms over time, especially if illness forces someone to spend long periods in bed. But being disconditioned isn't the same thing as being lazy, and POTS can affect people who are active or athletic before becoming ill. A third misconception is that if someone looks healthy, they must feel healthy. POTS is often an invisible disability. A person may look completely fine while sitting down because sitting or lying down can reduce their symptoms. When they stand, walk, enter a hot environment, or use up more energy, their symptoms may become much more noticeable. Someone may also be able to participate in an activity one day, but not the next. That doesn't mean they're faking or exaggerating. Their symptoms and available energy can genuinely change from day to day, or even hour to hour. So how is POTS managed? There currently isn't one treatment that works for everyone. Management is normally individualized, based on the person's symptoms, blood pressure, other medical conditions, and possible underlying causes. A healthcare professional may recommend increased fluids and, when medically appropriate, increasing salt to help the body retain more fluid and support blood volume. However, increasing salt isn't safe or appropriate for everyone, especially people with certain heart, blood pressure, or kidney conditions. It should be discussed with a medical professional rather than copied from advice online. Compression garments may help reduce blood pooling in the legs and abdomen. Some people use compression that reaches the waist because abnormal compression can also be helpful. Physical activity may be introduced gradually and carefully. Some programs begin with reclined or seated exercises, such as stationary bike, rowing, or swimming, before slowly working towards upright activities. Exercise isn't an instant cure, and telling someone to just exercise more ignores how severe exercise intolerance can be. A program needs to be adapted to the person's abilities and ideally guided by a professional familiar with POTS. People may also manage symptoms by avoiding excessive heat, sitting during tasks, taking breaks, eating smaller meals, moving their legs before standing, and learning their personal triggers. Some people are prescribed medication. Depending on the individual, medications may be used to control heart rate, blood pressure, improve blood vessel tightening, or help the body retain fluid. There isn't one medication specifically guaranteed to fix POTS. Some medications can have some major side effects. Treatments need to be chosen by a qualified healthcare provider. Mobility aids, shower chairs, stools, accessible parking, and other supports may also help people conserve energy and reduce symptoms. Using an aid isn't giving up. It can allow someone to participate more safely and independently. If you know someone with POTS, one of the most helpful things you can do is believe them. Understanding that canceling plans may not mean they don't care, sitting down while everyone else is standing isn't rude, and needing extra water, salt, air conditioning, breaks, or a mobility aid isn't attention-seeking. Try asking, what would make this activity more accessible for you? Maybe they need to avoid the hottest part of the day. Maybe they need transportation that involves less walking. Maybe the plan needs more breaks or a shorter time commitment. Small changes can make the biggest difference. And most importantly, don't judge the severity of someone's condition based only on how they look during one short moment. So to recap, POTS stands for postural orthostatic tachycardia syndrome. It is a disorder involving the autonomic nervous system and the body's response to being upright. When someone with POTS stands, their heart rate increases significantly, and they may experience symptoms such as dizziness, palpitations, fatigue, brain fog, nausea, weakness, shaking, headaches, and exercise intolerance. POTS can affect many different systems in the body. Symptoms and triggers vary between people, and proper diagnosis involves much more than noticing a fast heart rate. Most importantly, POTS is real. It isn't simply anxiety, laziness, or a little dizziness. It can change how someone studies, works, socializes, exercises, travels, and completes basic everyday activities. But with greater awareness, appropriate medical care, symptom management strategies, and accessibility, people with POTS can be better supported in building lives that work with their bodies. Thank you for listening to this episode of Amber Resilience Co. If you know someone who still thinks POTS is just feeling dizzy when you stand, share this episode with them. Education creates understanding, and understanding helps people feel less alone. Whatever you're carrying today, just know you don't have to carry it perfectly, and it doesn't have to be perfect to count. Just you trying is enough. Thank you guys for supporting and watching this episode. It means a lot. I'm gonna be away for 2 weeks, so there won't be no podcast or vlog or chronically trying or anything like that for 2 Mondays. But I'm very excited for what's to come, and stay tuned for what's to come.